In this video, we'll be going over Wernicke's encephalopathy, first described by Carl Wernicke as a group of case studies with similar symptoms, later discovered to be due to vitamin B1, also known as thiamine deficiency. Thiamine is an essential vitamin not produced by the body. Sources include meats, whole grains, fortified breads, and cereals. It's used in metabolic processes which convert carbs, fats, and protein into energy. Therefore, for every 1000 kilocal of energy consumed, we need around 0.3 milligrams of thiamine to actually convert it into usable energy. Thiamine is absorbed in the duodenum using a carrier-mediated process, which is also its rate-limiting step. Alcohol inhibits the intestinal ATPase, which inhibits the absorption, since less ATP is available for the active step. Once absorbed, it's converted into its active form, thiamine pyrophosphate, by a reaction which uses magnesium as its cofactor. So in some cases, hypomagnesemia can actually mimic thiamine deficiency. Once absorbed, it's stored in the liver for up to 18 days. When present in sufficient quantities in the blood, it passively diffuses across the blood-brain barrier. When in low quantity, it's actively transported. Thiamine and enzymes that require it as a cofactor are present in all cells, and deficiency affects all organ systems. Thiamine acts as a cofactor in the Krebs cycle and the pentose phosphate pathway, which are involved in the carbohydrate metabolism. The Krebs cycle is a central metabolic pathway that completes the oxidative degradation of nutrients in the mitochondria of every cell. The pentose phosphate pathway provides precursors for nucleotide and amino acid biosynthesis and provides reducing molecules for anabolism and to defeat oxidative stress. In this schematic, we can see the Krebs cycle and two enzymes that use thiamine as a cofactor, the pyruvate dehydrogenase and the alpha-ketoglutarate dehydrogenase. The main function of the Krebs cycle is to generate ATP. A decrease in ATP production, especially in the brain, leads to an increased production of toxic metabolites of dopamine and causes inhibition of the COMT enzyme, which is vital for synthesis and breakdown of dopamine in the prefrontal cortex. Inhibition of the pyruvate dehydrogenase also leads to decreased synthesis of acetyl-CoA, and therefore acetylcholine, which is linked with delirium and cognitive impairment seen in Wernicke's. Alpha-ketodehydrogenase plays a role in maintaining levels of glutamate and GABA. When malfunctioned, like in thiamine deficiency, it can lead to an imbalance between the two neurotransmitters, which can lead to neuronal excitation and delirium. Thiamine deficiency can also result in inhibition of the COMT, causing an increase in dopamine levels in the prefrontal cortex, causing delirium, hallucinations, and delusions. The pentose phosphate pathway is important for maintaining carbon homeostasis to provide precursors for nucleotide and amino acid biosynthesis and to provide reducing molecules. The pathway occurs in the cytosol of human cells, including the brain, and serves as an alternative pathway to glycolysis. Thiamine is a cofactor for transketolase in the pentose phosphate pathway and leads to production of ribose 5-phosphate and reduced nicotinamide adenosine dinucleotide phosphate, NADPH. Ribose 5-phosphate is needed for synthesis of nucleic acids, complex sugar molecules, and other compounds. NADPH provides hydrogen atoms for chemical reactions that result in production of steroids, fatty acids, amino acids, and certain neurotransmitters and other molecules. In addition, NADPH is involved in synthesis of glutathione, which converts reactive peroxide into water. Impairment of this process leads to conversion of peroxide to hydroxyl free radicals, which causes cellular injury. Thiamine deficiency can result from conditions that restrict eating, such as orofacial cancer or inadequate vitamin absorption, such as in gastric bypass surgeries, gastric and colon cancers, and hyperemesis gravidarum, or starvation by choice. By far the most common cause of thiamine deficiency is alcoholism. Wernicke's encephalopathy is a clinical diagnosis based on patient's presentation, but some laboratory markers that go with it are AST-ALT ratio of 2 to 1, which represents alcoholic hepatitis, low albumin, and prolonged INR. Levels of lactate can also be checked. Common presentation for Wernicke's encephalopathy is going to be a chronic alcoholic or a depressed patient who recently had the significant other pass away and is now not eating properly, and he's now found confused and disheveled, unable to provide history. Vitals will otherwise be normal. On physical, the patient will look thin and malnourished and will have some oculomotor abnormalities and gait ataxia. Treatment will be to give IV thiamine, which will improve the oculomotor abnormalities within hours. Other abnormalities might take weeks. Korsakoff syndrome is a late-stage complication of thiamine deficiency due to repeated or prolonged episodes of Wernicke's. Neuronal death often occurs in certain neuronal populations that have high metabolic requirements and have high thiamine turnover. Areas commonly affected by thiamine deficiencies are the medial dorsal thalamic nucleus, the mammillary bodies, the periaqueductal gray matter, and the floor of the fourth ventricle, which includes the oculomotor, vestibular nuclei, and the cerebellar vermis. Lesions may also involve the fornicles, the hippocampus, the area around the third ventricle, the quadrigeminal bodies, and the cortex. The predilection to affect memory circuits is responsible for the sequelae of Korsakoff's psychosis. Patients will have confabulation, but cognition, attention, and social behavior and long-term memory will sometimes remain intact. The most commonly tested is the mammillary body atrophy seen on MRI, and symptoms really reverse with treatment. In this lecture, we covered Wernicke's encephalopathy and Korsakoff syndrome due to thiamine deficiency. We covered the pathophysiology and the presentation, and the treatment, which is giving IV thiamine in anyone you suspect will have thiamine deficiency. Thank you for watching, and give it thumbs up if you enjoyed watching the video.